I knew that I wanted to be a physical therapist before I went to college, and decided to get a bachelor's degree first and then go on and get my, at that time, certification in physical therapy. Once I started seeing patients, I knew that I wanted to do some research in the field. So while I was seeing patients and doing some work as a lab instructor in a physical therapy program at the University of Pennsylvania, I also got my PhD in physical therapy. And the combination of my undergraduate degree, the physical therapy, and my research degree has led to exploring treatment outcomes in physical therapy, and specifically in vestibular rehabilitation, which is the area that I focus on now. It's difficult to summarize everything that a physical therapist does or could do in the rehabilitation of people who have different disorders, because there's such a wide range of what they do. In general, I think all physical therapists help the patient move back toward their normal activities. And if they're severely impaired, it may involve teaching them and their families different ways of achieving really basic goals. Or for other people, it may be taking them all the way back to what they usually do. The physical therapist is the person who spends the most time with the patient in the rehabilitation process, along with some of the other therapies like occupational therapy. So they really are the ones who are listening to the patient's problems, are trying to solve more than just the movement problem or the pain-related problem the patient has, but how the patient is going to reintegrate into the community and what they hope to have as their normal life. We're really lucky to be here in a medical school and at Emory University. When our students or the therapists who are out seeing patients have problems or questions, there's this huge resource that's immediately available to us. So we can quickly email somebody, we can go into their clinic, we can have them seen very quickly by another specialist. We have the library resources, the research resources. It's just a tremendous advantage to be centered here at an institution like Emory. Well, I think probably it's the resources that are immediately available to us. So when I'm seeing patients, the neurologist who sees patients in our center is there as well, and the technician is there, and I can have tests done immediately. And I think that's true for all the practices of our therapists. The therapists that are over in another building, for instance, are there with the neurosurgeons, the neurologists, and the physical medicine physicians. So we can immediately talk to people and get the best possible patient care, because we're all working together to help the patient. Oh, what do I like to do for fun? I love to cook, and especially, well, I have to be careful. I have to say I love to cook when I'm entertaining, because if I cook that way for myself, I have even more of a battle about weight. But I love to cook, and I also love to run. So I've done a number of marathons and half marathons and other shorter races, and it's really been a wonderful part of my life to do those two activities, and they balance each other out.